you need any comment or background, I should say, if you need any background afterwards, please give me a call. In our organization, we actually prefer very much to have nurses be the voice of the union, so I typically don't go on the record. But thank you again so much for being here. So the first person who's going to speak today is Madison Light. She is a float pool nurse, and she will address us first.
Oh, thank you. Good afternoon. My name is Madison Light. I'm a nurse in the float pool at Maine Medical Center. That means I work in several different departments, and I have a global view of what's happening at the hospital and the conditions in which Maine Med nurses are working. Let me tell you, the people who come to work every day in this building behind us are working incredibly hard. They're dealing with some of the most daunting conditions that any of us have seen in our entire careers. Just when we thought we might be getting over the worst of COVID, the Delta variant hit, and now it feels like there's no end in sight. Nurses and caregivers are exhausted, frustrated, stretched to their physical and emotional limits, while still trying to provide the best care that we can for people that come to us for help. Now, let me tell you a little about our employer's response to this situation. Last year, Maine Med did some really good things. Things that protected us and our patients and made life a little better under incredibly difficult circumstances. They made sure that those at higher risk of complications from COVID could work in less risky areas of the hospital to keep them from getting sick. They covered the cost of treatment for employees who did get sick from COVID. They provided quarantine pay to exposed and infected employees, regardless of where they acquired the virus, as a protection to other staff members and to our patients. They also allowed pregnant nurses to have paid time off at 37 weeks of pregnancy to quarantine. This protected the nurse, their baby, and the staff that cared for them upon delivery. Over the past couple of weeks, Maine Med has told us that they are ending all of these protections, not just for nurses, but for all Maine Med employees. Now, we've been told by upper Maine Med management that these protections are no longer necessary because of the COVID vaccines and everything we've learned about the virus since it hit our hospital. But as nurses, we know that vaccines, as critical as they are to ending this pandemic, are not a silver bullet. Proper PPE, appropriate distancing when possible, and a robust testing program are all necessary to stop this pandemic from infecting more staff and patients here. And we also know that in the middle of a spike of infections from a fast-moving variant, this is not the time to remove the protections that have helped both staff and patients here for the past several months. As newly organized nurses, we have found our voice to speak together in the clearest way possible to our employer. Dear Maine Med, show us that you're willing to see us through the entire pandemic. Immediately restore these protections. Thank you.
Thank you, Madison. Speaking next is Emily Wilder. She is a critical care nurse at Maine Medical Center.
Hello, my name is Emily Wilder. Like Todd said, I'm a critical care nurse here at Maine Medical Center. I'm also a new mother. My little one is just 6 months old. When I became pregnant, this new virus created so much uncertainty, not only for myself, for my family, but for all of my fellow nurses, all of our coworkers at Maine Med who are also pregnant. We all wondered, how would COVID affect the health of our unborn babies? How would it affect our pregnancies? Would the PPE that we got be enough to protect us? Could we count on our employer to make sure that we had what we needed in order to continue to care for these very sick patients? Unfortunately, in our critical care departments, we didn't always have the PPE that we needed that follows what we nurses call the Precautionary Principle. Specifically, we often had to reuse our N95s, which are supposed to be single use only. We would reuse them day after day. This precautionary principle states that if a course of action or inaction is likely to cause irreparable harm that it should be avoided at all costs. Translated into our nursing care, that means that in a novel environment, like what we have been seeing with the coronavirus, every possible protection must be taken to protect the health and safety of caregivers and patients alike. We are still in a novel virus environment. The precautionary principle still applies today. But our employer is rolling back the critical protections that it gave us during the early times during the pandemic. Just as the numbers, the severity, and the cases are all spiking again, I was one of the happy beneficiaries of one of these protections that was given to nurses. Something I received was that at 37 weeks, we were able to take paid time off out of work so that there was no risk of us getting exposed either at work or at the community. We were supposed to self-quarantine at home to protect both ourselves and our patients. This was a fantastic benefit. It was super unique, and it was amazing that we were able to receive it. This protection 100% followed the precautionary principle. It was thoughtful, it was based in science, and it was a huge relief not only to myself, but my fellow coworkers as well. We were happy to have this paid time off to protect ourselves and our families. We very much appreciated our employer supporting us to do that. But now this protection is going to end. Starting on October 1st, it is being taken away with no explanation given. We have vaccines and we know more about this than we did at the beginning, but do we know enough? Are we absolutely certain that this course of action will not cause irreparable damage or harm to pregnant mothers and their unborn children? We do not, and we are not. Maine Med has admitted, and they do acknowledge, that the risk to pregnant mothers remains huge. Under the precautionary principle, there is no justification for this abrupt change in policy or taking away this critical benefit. We earnestly and respectfully ask our employer to reinstate this protection for nurses and to roll back all of the other health and safety rollbacks that are happening right now at Maine Med.
Thank you, Emily. Last speaking today is Jonica Frank, and as I mentioned before, you're welcome to have Q&A with our speakers afterwards or speak with them individually after the event. Jonica.
Hi, my name is Jonica Frank. I'm a registered nurse in the operating room at Maine Medical Center. I have been a nurse for 11 years, 6 here at Maine Med. In the past few weeks, there have been 6 COVID outbreaks in different departments across the hospital, including my own. The situation in the building behind us is as acute or more acute than it has ever been during the course of the COVID pandemic. What has exacerbated this situation, however, is the fact that nurses and other caregivers most often find out from unofficial sources that an outbreak is happening where they work. This is what happened with the operating room outbreak. First, we heard rumors, then those who had bits of information passed that along to others, and then by the time management told us we were in the middle of an actual outbreak of the virus, we already knew. Now, this isn't because management didn't know what was going on. They keep close tabs on illnesses and outbreaks throughout the hospital, as they should. But for whatever reason, they didn't tell us what they knew when they knew it. Having up-to-the-minute updates on outbreaks in specific departments is critical information that we need for ourselves and for our patients. Finding out about an outbreak from peers, or even worse, the evening news, is not how critical information should be passed on to nurses. We hope and trust that information about COVID-19 outbreaks will be relayed to all Maine Med caregivers as soon as it is known in the future. But given that we have seen so many of these outbreaks in the recent past and may see many more in the near future, we implore Maine Med to do the right thing and keep all of the COVID protections for Maine Med employees in place. If anything, this is the time to increase protections for us, not take them away. We have all seen and experienced how the Delta variant is ravaging our state, our country, and even our entire world. We also know that there is no reason to believe that this variant will be the last or even the worst of this terrible disease. We have come a long way in understanding the basics of the virus. Our employer is fortunately now adhering to the PPE standards that our union has always demanded, including single use of N95 respirators and use of respirators that can be sterilized, like PAPRs and elastomerics. But if we start taking steps back now, we will leave the door open to further harm and the depletion of our workforce and our ability to care for all of our patients who come to us from many different parts of our state. Our employer must continue all the accommodations it has made to frontline employees, especially those who become ill, those who are vulnerable to complications from COVID-19, and of course, the pregnant nurses and other caregivers who are at advanced stages to their pregnancy. Thank you all for being here today and for listening to what we have to say.
Hey, Todd, can we just ask some questions because I'm not sure who the right person
Sure.
might be to answer them, and
Sure.
that might be easier than
Absolutely.
doing a bunch of
Absolutely.
sides. Thanks. One thing I wanted to ask was, you all talked about allowing high-risk employees to have different assignments. Can someone give me an example of who's a high-risk employee and what a different assignment would be?
Who wants to take that one? Go ahead.
Someone who would be at higher risk for complications of the COVID variant would be nurses or any other caregiver who has asthma, people who could be immune compromised for any reason. And instead of going to the units that have been dedicated to caring for COVID patients, they would go to a med-surg or other unit that is not known to be taking care of COVID patients.
Have you or anyone else here, are you in that group, and have you been denied such a reassignment?
I'm not in that group. I have not been denied such an assignment.
Is anyone? So is this a
The-
theoretical complaint or is it a real complaint?
I can speak to that.
Great.
I actually have a son with cystic fibrosis, which is a lung disease, so it puts him at high risk. And I was very concerned about possibly bringing anything back to my son. I actually applied for accommodations I work in the NICU, so I'm at very low risk anyways, but I asked for some simple accommodations as far as not putting me into a section that had a baby that was being ruled out for COVID, and I was actually denied those accommodations by Maine Med, and I ended up taking a leave actually twice through the pandemic when we had spikes to protect myself and protect my son before we got the vaccine. Since the vaccine, I have not taken any leaves, and my immediate manager has been very trying to accommodate, but I do not have any official accommodations from the hospital for that.
And what was your name?
My name is Janelle, Janel. My last name is Crowley, Crowley.
When was it announced that these precautions were going, I don't know if we should answer this, but that these precautions were going away, and then when are they expected to go away?
So I'll speak again on background.
Stand in the middle.
Sure, I'm sorry, Phil. On background, they are going away at different times. The 37-week pregnancy leave is ending October 1st. Some things have already been taken away. They've just been announced these things in kind of dribs and drabs. Without, there's not any uniformity. It's just, but they've made it clear that everything they put in place last year is going away.
And how was that announced? Has it been emails or other memos?
Emails?
Yeah, I can.
By
Okay,
email.
thank you.
So we haven't actually received a hospital-wide uniform email that states that these protections are going away. The way we're finding out is whether it's an email, either in part or all of the protections from our managers or our directors. But a lot of nurses and employees have not received such an email, and they're finding out through coworkers or just on Facebook or other places. So they're not finding out directly from the source.
Is that part of what you guys see as the problem? Do you want to see some uniformity?
Yeah, we would absolutely love that. We would absolutely love a direct line of communication where things are just streamlined and the information needs to be given to us right when it's available and safe.
I have two more questions, General, whoever wants to answer them. You complained that they're no longer going to cover the cost of COVID treatment. What about your health insurance? Would that cover the cost of treatment for COVID or anything else?
Who wants to take that?
do it again.
Yeah, go ahead.
Or Todd, you can answer too.
Yeah, so that's a great point. A lot of employees at Maine Med and Maine Health in general do have health insurance, but a lot of ours do not. So certain part-time people may not have insurance. We have a ton of per diems who are helping to support us right now, especially during the pandemic. We're relying on their support very, very heavily, and they might not be eligible for insurance for that very reason. So.
And also, isn't they paid your copays? They paid like during
Right. Yeah.
So they were paying for everything.
You
They
can.
were-
Yeah.
They were paying for everything, but now people are going to have to pay their copays. That's what it is.
I just have a general question. You may have another. My other general question is, beyond these important issues of your benefits possibly changing or being rolled back as you describe it, can you guys give us a sense of what's going on in there? We're hearing, and we heard last week, Maine Med and all the hospitals saying, we're maxed out. 90% of the ICU is filled with mostly unvaccinated COVID patients. One of you told me off camera it's an S show in there. What can you tell me on camera about the conditions because of this horrible COVID surge?
I would like to
Let's have John. Well, go ahead.
Hi, my name is Amy Strum and I work in the emergency department. Presently, right now, we have about 40 inpatient boarders that are taking up our hospital beds in the emergency department, making it very difficult for us to care for the community and emergency needs. Our staffing is very bad. Our ratios have really become almost, unsafe. We're usually 1 to 4. In our immediate, main room area, we are now 1 to 5 to 6. Breaks are almost non-existent. As far as COVID patients, we're definitely seeing an influx of COVID patients coming in. We do not care for those patients for long time. Usually they do go up to a COVID unit, so I don't know how sick they really are, how sick they become. But yes, I can say from the emergency room that we are under a lot of stress, staffing and acuity and census, and that's increasing.
Anyone else want to comment on that? The ICU conditions?
Yes, we'll have Emily say something as well.
Sure.
It is important. I mean, these are nurses. These are people who are. They take people where they are, as they are, no matter how they got here. That's one of the most amazing things about nurses and healthcare workers in general. So they are working under difficult circumstances, but doing everything they can to give people the best care possible. Emily.
Yeah, so like was mentioned, we do have dedicated units that are specific just to these COVID populations. We have an ICU that's dedicated just to COVIDs and then potential COVIDs, so those who we are ruling out for the disease. Often we have to pull nurses from other units just to staff that specific unit. So that means as the COVID numbers go up, we have to pull on nurses from different ICUs to make sure that that unit is filled. This means short staffing throughout the entire hospital just because of that increase in numbers.
I know outbreaks were mentioned a couple times, and I think even before we got started, you guys heard of another outbreak. How'd you hear of that one, and how are we hearing of all of these outbreaks?
I can speak to that. So I can tell you that from my experience, we heard it was a trickle down. Someone texted someone else, "Oh, I just tested positive," and it was over a weekend. And when people were contacted, people were trying to get a hold of employee health. They were told they would be contacted as they did their contact tracing, and that's how we were. Come Monday morning. Late Monday morning was when they announced that we were in the middle of an outbreak in the operating room. But I mean, that's how it's been going. It's it's sort of sometimes they're in front of it and other times they're not.
So the communication isn't coming directly from us.
No.
Maybe this is a question for Todd. Given that the current hospitalizations seem to be increasing mostly by unvaccinated people, excuse me if the union has already stipulated this, but I figured it's your first event, so I'd give you a chance to say it in person. Does the union have a position on vaccines and Maine Health's vaccine mandate?
So I will have one of the nurses answer that.
Okay.
we have put out a press statement earlier on that. We don't have much to add to what we've put out. If any of you need that statement later on, I'm happy to send it to you. But who wants to take that one?
Can I take this?
It'll be one of the three.
Yeah.
I'll tell you what.
Okay.
Go ahead.
I just wanted to let you know, Maine State Nurses Association and NNU, the union that we're part of, does encourage all eligible people to get the vaccine. But we want to make sure that that's with religious and medical accommodations respected.
I was just going to ask, has there been, with all these concerns, has there been attempts to meet with management or communicate in some way with management to not roll back these protections, and what is the response?
This I can take. In your press pack, there's a letter that the entire bargaining team, made up of 11 members plus myself, sent to management's representative last week. We got a response from them today that they are insisting on We got a letter, an email this morning telling us that they are insisting on rolling back rolling back all these protections for nurses and patients. So they've reiterated their position with us, and they are going to continue to take these protections away.
Did they say why, Todd?
They said that they believed that they were appropriate. We, of course, disagree. That's why we're here today. Any other general questions for the three?
Can you say who that email was from?
Yes, my counterpart in bargaining, which is their attorney contracted to handle contract bargaining on behalf of the employer.
Their attorney?
Yeah. And that letter is, you can see his name and everything is in your press pack. That letter should be in there. That's correct. Yep. Okay, well, thank you very much for being here. The speakers are available to speak with any of you who want to speak with them individually. But again, we really appreciate your time today. Just 1 second, Blair. Yep.